Right, well, a very good morning, good afternoon, good evening to all of you who are joining us now. I think we'll make a start on the housekeeping and allow people a few moments to continue to join us. This is the NIHR Global Health Research webinar for our group's Call 4. Could I have the next slide, please? Okay, so just before we get going, all of your cameras and microphones are actually set to mute. We are currently recording this webinar, and along with the transcript, we'll make it available to all of you after the webinar. Can you please use the Q&A button to add any questions that you may have or that arise during the course of the webinar? And if you see a question that's already been asked that you would like to ask yourself, perhaps you could just like that, and we can then address the questions that are most of interest to the attendees today. If you're having any technical issues, please can you use the chat button and we'll try and sort that out for you. Can I have the next slide, please? Right, well, I'm just going to introduce our presenters today. We have with us the Department of Health and Social Care representatives. We've got Stephanie Russell, Global Health Programme Manager. Steph, do you want to say hello?
Hello, good morning, everyone.
We've got Katie Robertson, our Global Health Programme Officer.
Morning, everyone.
And from the Secretariat from the Global Health Research Programme, we've got myself, Dr. Sarah Puddicombe, and we've got Faye Habens.
Hello, welcome everybody.
And we'll be joined by our Finance Manager, Renee Lewin, who I can't see there today. If you'd like to say hello, Renee, please do.
Good morning.
Lovely. And behind the scenes, we're being ably supported by both Lewis and Alina. So you won't see their faces, but thank you to the team for supporting it today. Could I have the next slide, please? Right, we're going to be covering an overview of the Global Health Research portfolio and the aims for the group's Call 4. We'll then move into covering some of the eligibility and selection criteria to help you in your application. And then Faye will be talking through more of the details about how we'll be ending with a Q&A session at the end, which hopefully will be about half an hour to answer any questions that you may have. Please submit questions at any time and we'll come back to them. Right, I'm going to move to the next slide, please, and I think I'll be handing over to Steph. Thank you, Steph.
Yeah, that's brilliant. Thanks, Sarah, and welcome everyone, and thanks for joining us today for this our fourth group's call through the NIHR. So as Sarah mentioned, I'm Stephanie Russell. I'm the Programmes Manager here at the Department of Health and Social Care, and I'm just going to introduce the portfolio and set the scene for why Global Health Research, and then my colleague Katie will talk a bit about the aims of the group's programme specifically. Next slide, please. Thank you. So the NIHR was established in 2006 under the UK government's health research strategy, Best Research for Best Health, and is funded by the Department of Health and Social Care. NIHR's work focuses on early translational research, clinical research, and applied health and social care research. And its mission is to improve the health and wealth of the nation through research. But in 2016, using Official Development Assistance Funding, or ODA, NIHR became a major funder of high quality applied health research and training in areas of unmet need in global health. All research activities commissioned and funded through our portfolio contribute towards the UK's aid commitment, and they must deliver direct and primary benefit to countries eligible to receive the ODA funding. This supports the UK government's commitment to ensuring healthy lives and promoting well-being in the world's poorest countries, as set out in the UN's Sustainable Development Goals. The Global Health Research Programme work rapidly developed within the NIHR, but it's now embedded as a core NIHR work stream. Although working globally, the work of the NIHR's Global Health Research Programme comprises many elements of the NIHR's other 5 domestic core work streams, which you see on this slide. Next slide, please. Thank you. So this is our Global Health Research Strategic Framework. And it shows that our aim is to generate high quality applied global health research and training to address the unmet health needs of people in low and middle income countries. As we're now in 2022, for the next 3 years, our strategic priorities are addressing the shifting global burden of disease, developing health systems to identify and respond to population needs, building resilience to tackle future global health threats, and importantly, strengthening research capacity in LMICs through equitable partnerships between low middle income country partners and UK researchers, which we see as a cross-cutting priority across all of our global health research funding. Our research programme is driven by NIHR principles, which are impact, excellence, inclusion, collaboration and effectiveness. Reflecting the domestic NIHR programmes, we champion the involvement of LMIC communities in all aspects of the research that we fund to improve its reach, quality and impact, and enabling patients and communities to have a genuine voice in global health research, all the way through from the funding process to study design, delivery and dissemination. It's essential to achieving our ambition for long-term research, impact and changing lives. Next slide, please. Thank you. So this shows how we fund through the portfolio, which is through a variety of mechanisms. So we fund global health through completely researcher-led calls, such as this one, which is open competition with ideas for the most important topics suggested by the research community. Through commission programmes, which still have a researcher-led element, but the funding calls are in a particular priority or thematic area, such as for our RIGHT programme, which currently has a call open in multiple long-term conditions, which you can join a webinar for next week. Capacity strengthening is the other way we fund. So we have calls specifically focused on training, such as global professorships, and strengthening capacity through partnerships with other funders, noting that capacity strengthening is woven through all of our calls, with funding provided for both training and development of researchers, as well as crucially the research support staff who keep the research running. So all our funding targets underfunded or under-researched topics that have been prioritised by researchers in low and middle income countries to address topics specific to those countries. So next slide, please. So this just gives a few statistics on our portfolio to date, what we call the first phase of 5 years from 2016 to 2021. So since 2016, our global health research portfolio has grown and developed at pace. In the first 5 years of the programme, we funded more than 50 major UK researcher-led collaborations with over 200 organisations in more than 50 low and middle income countries worldwide. We've also funded more than 380 individual researchers to achieve formal qualifications through our programmes. And these numbers are all set to increase as we announce a number of new award holders this year who have been successful through recent funding calls. So I'm now going to hand over to Katie. Next slide, please. So Katie leads on the delivery of the group's portfolio, and she's going to talk a bit about the specific aims of this scheme. Thank you, Katie.
Thanks very much, Steph. And before handing back over to Sarah, I wanted to quickly set the scene and situate the Global Health Research Groups programme within our portfolio, which Steph has just introduced. So as mentioned, the Groups programme is one of 2 of our entirely researcher-led programmes within the Global Health Research portfolio. The Groups programme is one of the original programmes within the NIHR Global Health Research portfolio and actually makes up its largest part. So we're very excited about launching our 4th call within this programme. So the aims of the Groups programme, which you can see on this slide, are laid out in the call guidance, but just to briefly touch on them here. The Groups programme looks to bring in new research expertise within the global health research space, including UK researchers who haven't worked in global health before and are looking to pivot to global health through new equitable research partnerships with institutions based in low and middle income countries. So this UK LMIC partnership model is a key focus of the Groups programmes, and awards are administered through UK institutions, and the focus on equitable partnerships is absolutely paramount to the Groups programme. So as mentioned in our strategic framework, which Steph introduced, research capacity strengthening is a key cross-cutting component in all of our programmes and remains equally important within this Groups programme and in this call. So as we mentioned, this is the 4th call within the Groups programme. Awards that were funded as part of calls 1 and 2 are already in the public domain, and shortly we will be able to share the details of successful award holders from Groups call 3. One last thing to mention on Groups Call 4 is that we're very excited to be welcoming applications which include elements of methods research. This is a new step for us, and we hope it will lead to an increase in the evidence base on best methods and practice in global health research. So without further ado, I will now hand back over to Sarah, who will talk through this call in a bit more detail. So next slide, please.
Thank you very much. And yes, as Katie said, I'm going to now cover some more of the call-specific remit information around Groups Call 4. Could I have the next slide, please? So just to summarise some of the key points around Groups Call 4, Katie has touched on some of these already. This call will be for the first time a two-stage assessment process. We've listened to feedback from applicants, and we'll be doing a two-stage process. So we're inviting specialist researchers from the UK and LMICs who are keen to pivot to global health and develop new partnerships, or those that may have smaller scale partnerships that wish to extend those, but into new health areas and or geographies. We're looking for ambitious developmental applied global health research programs, really focused on addressing unmet needs, but in research and capacity strengthening, because both are seen as vital in this call. And we want that to be achieved through strong, equitable partnerships that will ultimately lead to improved evidence and health outcomes in LMICs. Now, when I talk about developmental programs, I mean that there may be scoping studies, startup phases for developing the partnerships, small scale needs analysis, pilot studies, and maybe some trials. So that's the sort of elements we're looking to see. But within the capacity strengthening element, we do want to see a minimum of at least 3 academic training posts, but we would expect further research and support capacity training to be included. And because we're keen to see this trajectory towards future leadership, we would like to see that reflected in your applications. The amount of funding is up to 3 million, but we welcome awards from anywhere between 1 to 3 million and for a duration of up to 4 years. The one key requirement, as Katie had mentioned, is that we need to have 2 joint lead applicants. One must be based in an eligible LMIC institution and one in an eligible UK institution. And the flow of funds will go via contracting through the UK administrative joint lead. Could I have the next slide, please? In terms of eligible institutes, these will normally be higher education institutes, research institutes, or NGOs, which meet the criteria. And those criteria are essentially institutes that are able to competitively apply for research and capacity training funding and to deliver on that, have a track record in academic training posts such as MScs and PhDs, and really be able to demonstrate that they have the governance arrangements, the research management arrangements to manage complex awards. We have had a number of applications from different affiliated LMIC and higher income institutes. And we ask that if you're going to apply as a joint lead from either of these, that those institutes are legally independent. And a marker of that would be that the joint lead institutes would require some sort of collaboration agreement in order to apply and work together. In terms of joint leads or the principal investigators, we would expect those to be normally employed by the joint lead institute and equally to have one in each of the different contexts, with a track record of managing very large complex programs of research, or at least mentoring to support them in that process if they don't have a strong track record. In terms of co-applicants, other sort of commercial organisations, non-government organisations can apply as co-applicants. And if non-LMIC institutes wish to apply, then you must justify how that expertise cannot be found in an LMIC and will ultimately benefit ODA eligible countries. Could I have the next slide, please? Now, because we've got a number of calls open, as the department mentioned, we do have some guidance on submitting multiple applications. So across all of our different programmes, we really do not accept the same or substantially similar applications across multiple programmes. So we suggest that you pick which programme you'd wish to apply for. However, if you do apply to more than one, the first that is progressed to the furthest will be taken forward and the other will be dropped. If you're coming from a similar team, then please make sure that you're submitting a substantially different proposal, different in the aims and the research, please. And also consider diversification of your leadership models to really support this future leadership development that we want to see in groups. In terms of institutional applications to the groups call, we are sort of alerting you to the fact that at the end of the day, we will only fund a maximum of 4 awards per joint lead institute, because we want to give opportunities across the piece. So if you're going to apply with multiple different applications from one single joint lead institute, please do consider the equality, diversity and inclusion of the teams and the composition of those awards. Think about the gender balance of those leads and how they will meet the aims of the call in hand. And just to alert you, we wouldn't expect more than one named individual to be a joint lead on any other application in this call. Of course, that doesn't preclude you from being a co-applicant on another group's award. Next slide, please. Now, there are a number of people who may have already applied for NIHR Global Health funding, such as previous groups award holders or other substantive award holders. If you're thinking of applying, then we do recommend you demonstrate ambitious plans to extend any previous research agenda, and that you do include thinking about including new health areas or geographies through equitable partnerships. And as I've mentioned, we want to see a continued capacity building element that reflects the aims of the group's call. And we would recommend that you consider new joint leads and perhaps mentoring of those by previous award holders, unless there's really good justification for why that shouldn't be the case. Next slide, please. In terms of all awards, obviously we expect them to demonstrate ODA eligibility. So please indicate which LMICs or regions will be directly benefiting from your research proposal, how the proposal will be of direct and primary relevance to their development challenges, how the outcomes will ultimately improve the health and welfare of individuals living in those countries. And if elements of research are not being undertaken in ODA eligible countries, or for instance, the country graduates from the DAC list, you must justify how the research would continue to be of primary benefit to ODA eligible countries. And I refer you to our guidance for further information on that. Next slide, please. So in terms of the eligibility of applications to this call, obviously we're looking for high quality applied health research and training programs. It can be in any field, but it has to have primary and direct relevance to the challenges faced by people in ODA eligible low middle income countries, align with the aims of the call, as you've heard earlier, the eligibility criteria and the call selection criteria, which I'll run through in a second. It would be good to see a real strength of institutional commitment to the research partnership and to sustained research capacity strengthening. And, you know, whilst that may be supporting some training posts, it may also be thinking about how you might sustain that support beyond the end of the award. The research partnerships must clearly meet local or regionally identified needs and really work to inform local and national plans for change through engaging the community and relevant stakeholders and actors in the context. And we're keen to see real support for embedded South-South as well as North-South learning. When you're thinking about issues of equity, please think about incorporating research questions that might tackle gender, age, social barriers to health and economic impact. And as Katie mentioned, elements of research methodology addressing gaps which are applicable to improve health research methods in LMICs more generally are welcomed, but they mustn't exceed more than 5% of the overall award value. May I have the next slide, please? Now, we have a number of calls open, and so elements of both health policy systems and multiple long-term conditions are eligible for groups, but we do recommend that if you have more major focus, you might consider whether your application is best fitting to other specific calls. For instance, Right 6 on multiple long-term conditions, where work, if it's going to be delivered through an existing partnership and focused on the development and evaluation of interventions, may be more applicable to that call. And also to consider whether a more health systems focused award or application might be better for global health systems and policy research. We will reserve the right to transfer applications to other calls should they open. And if you have any queries, don't hesitate to come and seek advice from us. Next slide, please. So I'm going to quickly run through the selection criteria. So for the stage 1, it's going to be a shortish application, and we will assess you against the following criteria: the relevance of the proposed research, the research quality and excellence, the strength of the team, and the impact and sustainability. So can I have the next slide, please? So when we talk about relevance, we're really keen to hear from you how you can justify that you're meeting an unmet health-related need and priority in an LMIC, and that you've engaged with the appropriate stakeholders in the context to ensure that that is a need. And that the plans have been based on some sort of review of the local context and health systems and literature. And we'll be looking to ensure that there is some training capacity development at individual and an institutional level, so that we can really see a high quality evidence being able to influence our practice and policy. Next slide, please. In terms of research excellence, then please make sure that your plans are very clear in terms of objectives and milestones, that you've got a robust design and methodology, you've considered the risks, and you're factoring in various ethical and legal considerations that may be relevant in the context that you're working in. We're also keen to see effective programme management. These are complex awards and you need good governance, institutional support, strong financial support and contract management to be able to cope with the reporting associated with ODA funding. And we do recommend thinking about sufficient resourcing. So for instance, a full-time programme manager at each of the partner sites, or at least one overseeing all of them. Next slide, please. We're also looking for a strong multidisciplinary team with the relevant expertise and very clear roles. That we're not looking for superficial roles. We want a clear defined role for each member. So think about the interdisciplinarity and think about the broad range of relevant disciplines that are needed to be able to deliver the research. And that won't be totally inclusive here in this list, but it may need to include, for instance, social science, health economics, etc. And when you're working with equitable partnerships, please make sure that you maximise the existing expertise that may exist in the LMICs that you're working in. And we would be looking for really strong equitable partnerships in terms of the ways of working, the leadership roles, the programme management, the governance, etc., the publications being produced. Next slide, please. And when we talk about impact and sustainability, we would like to see very clear pathways to impact and how that may, your research uptake and dissemination of those findings will ultimately lead to improving practice and informing policy, so that The research is sustainable in terms of both capacity and partnerships and impact in the countries for the longer term and beyond the end of the award. And when we talk about contributions, the research, this is about the contributions that the research will make to society and the economy, and how it will lead to improved scientific evidence, to improved health and well-being, lives saved, economic, social and cultural benefits in ELMIC countries. Next slide, please. At stage 2, those that are shortlisted after stage 1 will be assessed on all the following criteria. So the first 4 that I've already discussed, and the next 4, which are capacity strengthening. So obviously we want to see strong capacity strengthening at individual and institutional level. We expect to see embedded community engagement and involvement, and that is both communities, but also policymakers and other actors in the country and contexts that you're working in, so that they're involved from the very inception of the research through to the dissemination. We're talking about also seeing equity of partnerships, and we will scrutinise that those partnerships are indeed equitable. And we want to see the governance arrangements, the leadership of work programmes, the publication and the dissemination to be shared, and to value the relative expertise across the different teams in that partnership. And lastly, we want to see strong, good quality applications which give us value for money, and have considered the 4 E's, so economy, efficiency, equity, and effectiveness. Next slide, please. In terms of finance, I've mentioned already that the awards range from 1 to 3 million over 4 years. So you can pitch the application at the level that you want to reflect in terms of the nature of your award and the scale of your partnerships within that range, and just justify what you're going to be doing within that. At stage 1, we only require an overall cost, but we do ask you to think about all of the extra bits, the resourcing that you might need in terms of those program managers, financial capacity support, training and other things. And that you do consider the balance and the flow of funds between the ELMICs and the UK and ELMICs, because we'd like to see that really reflecting that the majority of work is happening in the ELMICs. And if that isn't the case, then please justify how the funding as it's directed will directly and primarily benefit the ELMICs in the award. We can also allow a responsive line to address any emerging needs of up to 5% of the total budget. But this is very high level at this point, and there's far more information in our finance guidance, and we'll be giving a more detailed finance webinar for those who are successful at stage 2. Next slide, please. If you'd like to know more about the funding and awards that we've already offered and are active or have recently completed, then please do look at our Funding and Awards website and our open data platform. You can get a lot of information around who the award holders are, where they're situated, and that might help you in terms of thinking about networks and partnerships. So please do consider that. Next slide, please. I'm going to be handing over now to Faye, who will talk you in much more detail around the application process. Thank you very much.
Hello and a warm welcome again to everybody, and thank you for joining us. Just a little reminder that do put your questions in for the Q&A session at the end. I've seen a few come in, but we'll be open for a lot more. So please do write those in. So I'm going to talk you through the application process and hopefully give you some hints and tips and ensure that your submission process is as easy as it possibly can be. So next slide, please. So as has already been mentioned, this group's call for will be a 2-stage application process. So we've made this change following feedback we've received from previous applicants to our programmes, and we hope that this will ensure a better application experience. So stage 1 is a much shorter outline of your proposal. your proposed research, and it will be assessed in the following way. So they'll go through an eligibility and remit check, and these are carried out to ensure that your applications meet the criteria set out in the guidance and is eligible for the call. There's potential that we may have to undergo a triage process, but this will only be undertaken if we receive a particularly high number of applications. And it's carried out by the funding committee members. And in another change, and following feedback again, any applications that are declined at triage this stage will now receive feedback. So if we go forward to the review by the stage 1 funding committee, and where applications are discussed, and they decide which ones will go forward to stage 2. And as mentioned, all applications, if they're declined or shortlisted to stage 2, will receive feedback. If you are declined, this is designed to be constructive and help you with future applications. If you're shortlisted, this will be things you need to consider to help with your stage 2 application. Once submitted, stage 2 applications undergo further external peer review, and applicants are given the opportunity to respond to these comments before their applications are seen by the stage 2 funding committee. So next slide, please. So this slide gives a more visual guide to what happens to your applications and when. So obviously the call is already open and we're having our briefing event today. So the next milestone in this call is the deadline for your stage 1 submissions on the 23rd of November. As you can see, you should hear the outcomes of your stage 1 submission in February next year. And if you're successful to stage 2, your submission will be due in May. So please make sure you have time scheduled in your diaries to complete these submissions if needed. And we would expect any successful project to start in July of 2024. And it's important to note that there's no real flex in these start dates. Next slide, please. So how are you going to apply to the Groups 4 call? So regardless of if you've applied to groups before, this time it is going to be different as we now have a new application system called Relevance. So this is our Research Awards Lifecycle Management System. If you've previously had an account with us on our other system, which was called MIS, you need to press the forgotten password link here, enter your email, and then you'll be able to register previously. But you must make sure that the email that you enter is the one that you were previously registered with on MIS. If you've never had an account on Rounds, you need to use the register button and follow the instructions. If you go through the apply now button on the website from the groups page, you'll be directed straight to this page on Rounds, and you have to do the same thing. So the link is here within the slides, and the slides are going to be circulated afterwards. So next slide, please. So the most important piece of advice I can give you when applying for our calls is to spend the time and read the guidance in full. We spend a lot of time ensuring that as much information as possible is in these documents, and they're there to help you. And I really can't stress enough how important these documents are. So make sure you read them fully. And you're going to hear me say that a lot throughout the rest of my talk. There are a lot of documents to read, and they will take a bit of time to read them all. So I'm going to try and break down a little bit what's in what and what they have to tell you. So the remit and guidance document, they're specific for this particular call, and they'll give you the scope of the call, the eligibility and selection criteria, and they'll set out the timelines. The core guidance applies to all global health calls run by NIHR. And we do aim to keep this regularly updated. So even if you've read it before, it's worth taking another look at it, because the chances are when a call's opened, it would have been updated. There's application form guidance, and these tell you what to put in what sections of the form and how to complete the form within Rounds. And as the system is new, these are quite detailed instructions at the moment, more of a click guide, and we hope that they will help you navigate your way through the new system as well. There's finance guidance, and this is here there to help you complete your full finance breakdown at stage 2, really, but they are important at stage 1, because you need to ensure that the figures you're putting in for your project are realistic and include everything you need. Committees don't expect to see huge changes in cost between stage 1 and stage 2. So don't just do a finger in the air and put a random number in your estimated costs at stage 1. We also supply a Word version of the application form, so you can see what information you need to include in the form and things like what the character counts are and the section headings, and you can do that without having to log into Realms. It is important to note, though, that this form is provided just as a guide and cannot be submitted. Only applications that are submitted through Realms will be considered. Next slide, please. So this slide gives a very brief overview of where you can find information within the different guidance documents. And I'm not going to go through it because, again, it will be circulated afterwards, but it's sort of a quick stop shop to show you where things are. So next slide, please. So as I've already mentioned, you must submit your application via Realms. Realms will close at the 1 p.m. deadline, and this is UK time, so please don't forget that. Late applications will not be accepted, and if you're experiencing issues with Realms or you're having any other technical problems, you must tell us in good time. There's no point telling us 2 minutes before the deadline because we won't be able to help you then. So please don't leave it to the last minute to submit. At stage 1, you are able to include limited number of uploads. There's only one that's mandatory, which is your references, and this is limited to a single page. You can also include a single supporting document, and this could be something like a flow diagram or a letter of support, or maybe a response to feedback you received previously. And also, if you're an existing or previous NIHR Global Health Award holder, then you can include a letter of support which highlights what that award has achieved in its lifetime and how it's benefited the end user of that research. So next slide, please. So as been mentioned, these awards require joint leads, one from an LMIC and one from the UK. The UK-based joint lead will be the contract holder for these awards, and they will be responsible for the submission on Realms. So it's important to note that it will only be them that are able to submit the application. Both joint leads do need to register on Realms, and they do need to complete tasks, but only the UK joint lead, as the contract holder, can submit the application. You can also add the names of your co-applicants at stage 1, but the co-applicants don't need to register and complete any tasks on Realms yet. They will need to be able to access Realms at stage 2. So if you're adding them, please bear that in mind. The sign off and individual tasks can be the most problematic part of any application process. So it's a good idea to let people know what's required of them and what they're going to need to do well in advance and when you ask them to join your team. Collaborators can also be included, but they would go into your research plan and don't need to be entered individually into Realms. So next slide, please. So now a few tips for success. So next slide. So the first, and it is the most important tip, once again, is to read the guidance. Once you've read it, you'll have a clear picture of what's expected from your the applications, and you must ensure that you have met the eligibility and remit in full and give a clear and full explanation of the research you wish to do and how you're going to complete it. You should also include how this will be impactful and make a difference. Make it clear how you've worked with your whole team, how you've engaged with the joint lead and the co-applicants and what input the local communities have had. Make sure that you engage people like finance teams and your institution to ensure you have the right support and the infrastructure in place. So next slide, please. So it's important to note that at stage 1, the application forms are short. So you please be mindful of the space that you have and make sure your application is concise and to the point. Don't have too many partners. you'll have to be clear about how each one is involved, and if you're successful, you need to ensure you'll be able to do things like collaboration agreements with each of these, which can be quite a task. Make sure that you're writing in plain English. The committees and reviewers of the applications come from all different backgrounds. They might not all have English as their first language, and they do need to understand your applications easily, so please make them easy to read. You should make sure you're clear about your proposed study and how it builds on anything you've done previously, but you should also be clear on how this differs and what aspects of your application are new. You should include mentoring and support packages and help develop new leaders and new leadership models. If your application is a resubmission, make sure you take into account any feedback that you have received previously. Make sure both joint leads have registered on rounds and completed any associated tasks, such as their personal profile and their ORCID registration. Make sure you submit on time and don't leave things to the last minute. And once again, the 1 p.m. deadline is UK time. So next slide, please. So some next steps. Next slide. So, submission checklist. Have you got a clear application that meets the core specification as it's set out in the guidance? Have you ensured that you've met the eligibility criteria? Tick. Have you included all the required uploads? And we will say here, don't include anything that isn't requested, because we will remove that before the committee sees it, so it won't be assessed. And if you have any questions, do contact us. We're at the end of the phone, end of the email, so do contact us if you need to. It's very important that if you have any issues, we know them well in advance. So next slide, please. So in conclusion, make sure you read the guidance in full. Yes, it's long. Yes, there's lots of it, but I promise you it's all useful. Make sure both joint leads are registered on rounds and on ORCID. Ensure both joint leads have completed their profiles and associated tasks in the system. The system will tell you if they haven't, and it's up to the UK-based joint lead to make sure that these are checked and check that everything's been done. Don't miss the deadline in rounds, because it will close at 1 o'clock UK time. We can't change this, and a late submission will not be accepted. Do not leave it to the last minute to submit. And finally, good luck.